Every single year in the United States, over 1 million adults find themselves sitting in an emergency room due to an adverse drug reaction. And a profoundly shocking percentage of these visits are driven by sudden, life altering cardiovascular events, specifically heart attacks and strokes, triggered by the very medications they were told were perfectly safe. Let that sink in for a moment. We are not talking about illicit substances or highly experimental treatments. We are talking about the completely normalized, aggressively marketed pills currently sitting in millions of medicine cabinets across the country. In fact, large scale clinical data has revealed that simply taking certain over the counter pain relievers or seemingly standard daily prescriptions for as little as 1 week can increase your risk of a sudden myocardial infarction, a heart attack, by up to 50%. As a longevity physician and clinical researcher who has dedicated my career to optimizing the health span of vibrant, active adults, I find this statistic not just alarming, but entirely unacceptable. I am sharing this with you right out of the gate, not to induce panic, but because I operate on a fundamental principle of absolute transparency. You deserve the unfiltered, scientifically backed truth about what is actually going inside your body, especially when it concerns the very engine of your vitality, your heart. In my clinic, I sit across from incredible individuals every single day, people just like you who are actively leaning into this deeply rewarding chapter of life. You are traveling, managing businesses, hiking new trails, playing on the floor with your grandchildren, and taking proactive steps to maintain your independence and strength. You are doing the work. Yet, time and time again, I see patients who are diligently exercising and eating beautifully, but who are unknowingly placing a tremendous silent burden on their cardiovascular system because of a few small pills they swallow with their morning coffee. The conventional medical system, as well intentioned as many of my colleagues are, often operates on a fundamentally flawed model. It is a system built around the 15-minute consultation where the most efficient way to end the appointment is to write a prescription to suppress a symptom. Have a slightly elevated blood pressure reading. Here is a pill. Experiencing some joint stiffness after your morning walk, take this daily anti-inflammatory. Acid reflux from a late dinner, add another pill to the organizer. What is critically missing from this approach is the understanding of systemic biological interaction. Your body is not a collection of isolated organs. It is an exquisitely tuned, interconnected symphony. When you introduce a synthetic compound to silence a pain receptor or block an enzyme in your stomach, that compound doesn't just clock out and go home. It travels through your bloodstream, physically washing over the delicate inner lining of your arteries and interacting with the electrical pathways of your heart. Over time, these daily chemical interactions can cause the blood vessels to constrict, elevate arterial pressure, and promote the formation of Micro-Clots. The conventional model often fails to warn you that the medication masking your knee pain might simultaneously be stiffening your arteries and thickening your blood, pushing your heart to work twice as hard just to maintain baseline circulation. This is precisely why we are having this conversation today. You are not someone who passively accepts the baseline narrative. You identify as the CEO of your own health. And a good CEO requires accurate data to make executive decisions. My goal is to equip you with that data. We are going to look past the pharmaceutical commercials and dive directly into the clinical reality of how these 5 common categories of medications are quietly undermining your cardiovascular resilience. More importantly, we are going to pivot immediately toward empowerment. We will discuss exactly how to protect your heart, how to safely evaluate your current regimen with your local care team, and how to utilize the latest in longevity science to reclaim your body's natural healing capacity. You have decades of vibrant living ahead of you, and it is my job to help ensure your physical engine is strong, clear, and ready for the journey. We are going to build a fortress around your cardiovascular health starting right now. And to construct that fortress, we must first understand the structural integrity of the materials we are working with, which means looking deeply at the cellular level. I want to validate exactly why these medications find their way into your daily routine. When you wake up and your lower back aches from spending a glorious sun-drenched Saturday transforming your garden, or your knees protest when you are getting down on the floor to play with your grandkids, the instinct to reach for an over-the-counter pain reliever is not just understandable, it is deeply human. You are an active, vibrant person who refuses to let a little inflammation dictate your schedule. You want to stay in motion, to keep traveling, to keep building, and that relentless drive is exactly what I love about my patients. You are not willing to be sidelined by stiffness. The pain you experience is real. The structural wear and tear from living a remarkably full life is real, and nobody should have to endure chronic discomfort. But as your partner in longevity, I need to guide you towards solutions that honor your drive rather than secretly taxing your cardiovascular system. Here is the biological reality of what happens when you swallow that common anti-inflammatory pill. These medications, scientifically known as NSAIDs, non-steroidal anti-inflammatory drugs like ibuprofen and naproxen, are incredibly effective at their primary job. They work by blocking specific enzymes in your body called COX-1 and COX-2. These enzymes are responsible for producing hormone-like substances called prostaglandins, which are the chemical messengers that tell your brain, hey, this joint is irritated, let's create some inflammation and send a pain signal. When you block the enzymes, you block the messengers, and the pain magically fades away. You feel great, you lace up your walking shoes, and you get on with your day. However, biology is never a single lane road. Those exact same prostaglandins that cause your knee to ache are also running a highly sophisticated, round the clock maintenance operation inside your cardiovascular system. They are the master regulators of a delicate balance between keeping your blood vessels wide open and ensuring your blood can clot when necessary. Within the ultra-thin, miraculous inner lining of your blood vessels, a layer of cells called the endothelium, these compounds stimulate the release of nitric oxide. Nitric oxide is the absolute molecule of youth for your vascular system. It tells your arteries to relax, to expand, and to let oxygen-rich blood flow effortlessly to your heart muscle and your brain. When you take that pill to silence your knee, you are simultaneously silencing the production of these protective cardiovascular compounds. You are inadvertently turning off the nitric oxide faucet. Without that constant relaxing signal, your blood vessels begin to constrict. Think of it like taking a perfectly flexible garden hose and slowly tightening your grip around it. The pressure inside the hose has to go up just to push the same amount of water through. In your body, this manifests as a silent spike in blood pressure, adding immediate mechanical stress to your heart. But the cellular disruption does not stop there. Because you have altered the enzymatic balance, your blood platelets, the tiny cells responsible for clotting, suddenly become much stickier. They lose their smooth Teflon-like coating and act more like Velcro. Now, you have a perfect invisible storm brewing. Your blood vessels are tighter, the pressure is higher, and the blood flowing through those restricted pipes is significantly more prone to clumping together. This is the exact physiological recipe for a microclot. If that sticky clump of blood catches in a narrowed artery feeding your heart, it causes a myocardial infarction. If it travels upward and catches in a vessel feeding your brain, it triggers a stroke. This cascade of events does not take decades to unfold. The latest clinical data shows that this dangerous shift in blood viscosity and arterial constriction can begin within the first 7 to 14 days of continuous use. Your heart, which has been faithfully beating over 100,000 times a day, is suddenly forced to pump thicker blood through tighter tubes, working essentially against a biochemical headwind that you swallowed with your morning juice. It is a profound mechanical stress placed on a beautifully engineered system. I see the sheer frustration in my patients' eyes when I explain this mechanism. You took a pill to stay active, to keep your heart healthy by moving your body. And the irony is that the very tool you use to facilitate your wellness is silently compromising your vital engine. It feels like a betrayal by a medical establishment that sold you these quick fixes as harmless, everyday staples. But understanding this cellular mechanism is your greatest advantage. You are now equipped with the biochemical why, which is the exact foundation we need to start making different, more highly leveraged choices for your vibrant future. Armed with this understanding, it is time we shine a bright, clinical light on the pervasive myths that have been sold to you by an industry that profits heavily from your continued reliance on their products. For decades, a narrative has been deeply woven into the fabric of American healthcare. A story that insists if a medication is available over the counter, sitting right there on the shelf next to the toothpaste and vitamin C, it must be inherently harmless. We have been conditioned by multi-million-dollar marketing campaigns featuring smiling, active adults playing tennis or walking on the beach to believe that these brightly colored boxes hold the ultimate safe key to uninterrupted vitality. This is perhaps one of the most dangerous and widespread medical illusions of our time. The convenience of purchasing a potent systemic drug without a prescription has completely blurred the line between a benign supplement and a serious pharmacological intervention. When you casually toss a bottle of ibuprofen or naproxen into your grocery cart, you are not buying a simple wellness tool. You are purchasing a powerful chemical agent that, as we just discussed, fundamentally alters your vascular dynamics and platelet function. The medical establishment has, unfortunately, been complicit in perpetuating these outdated paradigms. Consider, for instance, the monumental shift we have recently seen regarding the daily low dose aspirin. If you are like the vast majority of my patients, at some point in the last 20 years, a well meaning doctor likely told you to start taking a daily baby aspirin to protect your heart. It was handed out like absolute candy, treated as a universal biological shield. Millions of vibrant individuals dutifully swallowed that pill every single morning, believing they were building cardiovascular armor. Yet, rigorous modern clinical trials eventually revealed a startlingly different reality. We discovered that for healthy adults without a prior history of cardiovascular disease, that daily aspirin was actually doing more harm than good, dramatically increasing the risk of severe gastrointestinal and intracranial bleeding. The medical guidelines had to be completely rewritten, quietly walking back decades of universal recommendations. Let me pause right here and ask you, how many times have you been handed a prescription or told to just grab something off the shelf without a single word being spoken about your heart or the long-term consequences? Please let me know in the comments below, because your individual experiences absolutely matter, and sharing them helps others in our community realize they are not navigating this complex system alone. And if this scientific breakdown is making sense to you and helping you rethink the contents of your medicine cabinet, I would be truly honored if you tap the like button so this vital, life-saving information can reach more people just like us who are taking charge of their health. The aspirin reversal is a profound example of why we must constantly question the status quo, but it is far from the only one. Let us look at another wildly popular category of medication that you might be taking right now: proton pump inhibitors, commonly known as PPIs, used to treat heartburn and acid reflux. These drugs were originally designed and approved for short-term use, typically meant to be taken for no more than a few weeks to allow an ulcer to heal. Today, they are handed out like breath mints, with people staying on them for years, if not decades, to manage indigestion from eating late or consuming trigger foods. The myth is that these pills simply turn off the acid in your stomach. End of story. The clinical reality is far more insidious. Recent cardiological studies have demonstrated a deeply concerning link between long-term PPI use and a significantly elevated risk of major adverse cardiovascular events, including heart attacks. How does a heartburn pill affect your heart? Because the precise enzymatic pathway these drugs block in your stomach is also intricately involved in your body's ability to produce that miraculous molecule we discussed earlier, nitric oxide. By suppressing stomach acid with these specific synthetic inhibitors, you are simultaneously starving your cardiovascular system of the very compound it needs to keep your arteries flexible, relaxed, and open. We are systematically discovering that the pill for every ill philosophy is fundamentally incompatible with true longevity. The conventional approach looks at a symptom as an enemy to be silenced at all costs, even if the weapon used causes collateral damage to your most vital organs. But you are not a collection of isolated symptoms. You are a highly sophisticated beautifully integrated human being who is demanding more from life than just managing side effects. The medications sitting in your cabinet are not inherently evil, but they demand profound respect and a rigorous risk to benefit analysis that you simply are not getting from a 15-minute clinic visit. The medical lie is that you need these chemicals to sustain your active lifestyle. The truth is that your body possesses an extraordinary innate capacity to heal, regenerate, and thrive. When we remove the chemical roadblocks and provide it with the right environmental signals, you do not have to accept arterial stiffness or elevated heart attack risks as the unavoidable cost of managing joint pain or digestion. We are going to shatter that false dichotomy completely. You do not have to choose between living without pain and protecting your cardiovascular system. There is a third path, a scientifically rigorous protocol designed specifically for adults who demand peak performance and longevity from their bodies. This is where we transition from understanding the biological risks into executing a highly strategic, actionable game plan. Think of this as your personalized longevity blueprint, a protocol that targets the root causes of the discomfort you are experiencing while simultaneously fortifying your heart and blood vessels. Let us tackle the systemic inflammation first, because I know that stiffness in your knees or lower back is the primary reason those over-the-counter pills make their way into your daily routine. Instead of chemically blocking your body's pain messengers and turning off your protective nitric oxide production, we are going to modulate your immune system's inflammatory response naturally and effectively. The cornerstone of this approach is leveraging high-quality, clinically studied nutraceuticals and targeted metabolic habits. Curcumin, the active compound found in turmeric, when formulated with black pepper extract or in a liposomal matrix for maximum cellular absorption, has been shown in numerous rigorous, double-blind, placebo-controlled trials to rival traditional NSAIDs in reducing joint pain and swelling. But unlike those synthetic pills, curcumin actually supports endothelial health. It acts as a powerful systemic antioxidant, sweeping up the free radicals that damage your blood vessels. We combine this with therapeutic doses of omega-3 fatty acids, specifically EPA and DHA sourced from pure wild-caught fish oil or algae. Omega-3s fundamentally change the lipid composition of your cellular membranes, literally replacing the building blocks of inflammation with the building blocks of repair. When you saturate your cells with these specialized fats, your body naturally produces fewer of the inflammatory compounds that make your joints ache in the morning, allowing you to move freely without taxing your heart. Now, what about the acid reflux that has kept you tethered to those proton pump inhibitors? We must rebuild your digestive fire rather than extinguish it. As we mature, our stomachs often produce less acid, not more. That weakening of the acidic environment actually causes the valve at the top of your stomach to stay slightly open, allowing whatever acid is left to splash up into your esophagus. Taking a pill to completely neutralize your stomach acid only exacerbates the underlying mechanical failure. And as we discussed, puts your heart at profound risk by shutting down nitric oxide production. The clinical protocol here involves optimizing your digestion mechanically and biochemically. We space your last meal at least 3 hours before you lay down to sleep, utilizing gravity as our first line of defense. We introduce digestive enzymes or a small amount of diluted apple cider vinegar before meals to naturally signal that esophageal valve to close tightly. We also systematically identify and temporarily remove the specific dietary triggers, often highly processed seed oils, excessive refined carbohydrates, or hidden sugars that are causing the initial mucosal irritation. By healing the gut lining, we eliminate the need for the medication, allowing your body to resume its natural life-saving production of cardiovascular protecting compounds. Optimizing your daily habits is a brilliant start, but it is only half of the equation. The other half is obtaining precise, high-definition data about the current state of your cardiovascular system. The standard lipid panel your doctor runs at your annual physical, the basic total cholesterol, HDL, and LDL reading is essentially flip phone technology in a smartphone world. It simply does not provide the granular detail we need to assess your true risk, especially if you have been relying on NSAIDs or PPIs for years, I want you to walk into your next appointment and request 3 specific advanced cardiometabolic markers. First, ask for an apolipoprotein B or ApoB test. This measures the exact number of atherogenic or plaque-building particles floating in your bloodstream. It is a far superior predictor of heart attacks than a standard LDL measurement. Second, request a highly sensitive C-reactive protein or hs-CRP test. This is the ultimate radar for hidden systemic inflammation. If your joints are aching and you have been taking over-the-counter pain relievers, we need to know exactly how much inflammatory fire is burning throughout your entire circulatory system. Third, and perhaps most importantly, I want you to discuss getting a coronary artery calcium scan or CAC score. This is a rapid, non-invasive CT scan of your chest that actually looks directly at the arteries of your heart to detect the presence and volume of calcified plaque. It is the absolute gold standard for knowing your actual physical present day cardiovascular risk rather than just guessing based on generic algorithms. I want to address the practical reality of navigating the modern healthcare system to get these advanced diagnostics, specifically when dealing with Medicare. The system can feel like an impenetrable fortress designed to say no to preventative care, but as an empowered patient, you have incredible leverage if you know how to use it. Medicare is heavily driven by diagnostic codes. If your physician simply codes an ApoB test as routine screening, Medicare will likely deny it and you will receive a frustrating bill. The secret to navigating this successfully is clinical justification. When you sit down with your doctor, clearly articulate your symptoms and your history. If you have a family history of heart disease, if you have experienced unexplained fatigue or shortness of breath during your morning walks, or if you have a documented history of chronic joint inflammation for which you have taken NSAIDs, your doctor can use these specific clinical details to justify the medical necessity of the advanced lipid panels and the hs-CRP test. The CAC scan is a slightly different story. Medicare typically does not cover it for asymptomatic individuals. But here is the excellent news. Because the technology has become so widespread, the out-of-pocket cost at most local imaging centers has dropped dramatically, often ranging from just $50 to $150. Consider this a direct, high-yield investment in your longevity portfolio. It is the cost of a nice dinner out, but it provides you with a definitive roadmap of your arterial health for the next 5 to 10 years. If your physician is hesitant to order these tests, simply look them in the eye and say, "Doctor, I am highly motivated to prevent a cardiovascular event rather than just wait to treat one. If you are not comfortable ordering these advanced markers, can you please refer me to a preventative cardiologist you are the CEO of your body, and you are entirely within your rights to assemble a medical team that aligns with your proactive, aggressive vision for health span." By replacing pharmaceutical band-aids with targeted nutritional interventions, demanding high-resolution diagnostic data, and learning to intelligently navigate the insurance landscape, you are fundamentally shifting the trajectory of your health. You are no longer a passive participant waiting for a symptom to appear. You are actively remodeling your biology from the cellular level up. You are restoring the youthful flexibility of your arteries, quenching the inflammatory fires that cause your joints to ache, and securing the powerful rhythmic function of your heart. This protocol requires dedication, absolute intentionality, and a willingness to challenge the medical status quo. But looking at the vibrant, uncompromised life you are building, I know you are more than ready for the task. You have already proven that readiness simply by being here, actively seeking out the high level scientific truth about your cellular health. When we strip away the pharmaceutical band-aids and stop suppressing your body's natural warning signals, something truly magnificent begins to happen. You stop merely surviving your days and start aggressively, joyfully thriving in them. Imagine waking up tomorrow morning, not with that familiar heavy dread of joint stiffness or the nagging anxiety about what those daily pills are doing to your heart, but with a profound sense of physiological confidence. You swing your legs out of bed and your joints feel fluid and capable. fueled by targeted nutrition rather than numbed by synthetic chemicals. You take a deep breath, knowing that your arteries are wide open, flexible, and fully dilated, delivering a rich, surging supply of oxygen to your brain and your heart muscle. This is not some distant, unattainable fantasy. This is the biological reality of what your body is designed to do when you provide it with the correct raw materials and remove the silent systemic stressors. Think about the trips you have planned, the gardens you are cultivating, the businesses you are running, and the legacy you are building with your family. Your cardiovascular system is the central engine driving every single one of those passions. By taking ownership of your health metrics, by demanding that advanced lipid panel, by securing that calcium score, and by substituting risky over the counter quick fixes with rigorous science backed protocols, you are quite literally buying yourself time. You are expanding your health span to match your lifespan, ensuring that your final decades are your most vibrant, capable, and fiercely independent. The conventional medical system may look at your birth year and subtly suggest it is time to slow down, to accept the decline, to just take the pill and manage the symptoms. But in my clinic, we wholly reject that narrative. We do not practice the medicine of decline. We practice the science of peak vitality. Your biological age is entirely malleable, and the choices you make today, what you swallow, how you move, and the data you demand from your doctors are the precise tools you will use to sculpt your future. I want you to feel incredibly proud of the steps you are taking. It is not easy to challenge a system that has been ingrained in us for decades. It takes courage to sit across from a physician and ask for advanced testing, and it takes discipline to change daily habits that have become second nature. But the return on that investment is immeasurable. It is the peace of mind knowing you are safe from hidden dangers. It is the exhilarating freedom of moving your body without restriction or fear. It is the deep, resonant joy of knowing you are going to be here strong and present for all the beautiful milestones yet to come. Your heart is an astonishing, resilient machine capable of remarkable healing when given the right environment. We are simply giving it the respect and the precise care it has always deserved. As your longevity physician, I consider it an absolute privilege to guide you through this complex landscape, translating the latest cutting edge clinical research into actionable steps you can use every single day. We have covered a tremendous amount of ground today, from the hidden dangers of everyday medications to the empowering metrics of cardiovascular protection. But this is only the beginning of our journey together. There is so much more ground to cover, so many more medical myths to dismantle, and an entire world of longevity science waiting to be unlocked for your benefit. If you found today's masterclass empowering, and if you are ready to continue building that unshakable fortress around your health, I warmly invite you to follow and subscribe to this channel. Join our community of vibrant, proactive individuals who are redefining what it means to age with power and grace. Together, we will continue to optimize your biology, protect your vital engines, and ensure that your best, most energetic days are always ahead of you.